So last week's video was all about the Pfizer-BioNTech COVID-19 vaccine. This week's video, as I promised, we're going to be looking at the Oxford AstraZeneca COVID-19 vaccine. You guys have sent loads of requests to do a video on this topic from my previous post where I was getting the vaccine, and also my post whilst I've been involved in the COVID vaccine clinics. So in this week's video, we're going to be looking at the evidence all about the COVID vaccine. We're going to be talking about how it works. We're going to be talking about side effects. We're going to be talking about who should get it, who shouldn't get it, and also everything we know about the COVID-19 vaccine so far and having it during pregnancy and loads more. Now before we begin, I just want to make you all aware that this video was filmed on the 23rd of January 2021. Therefore, all the information in this video is up to date on this day. However, this information is most likely going to change in the future. So the best way for you to stay up to date is to always speak to your healthcare professional and also visit the NHS and WHO website all about the COVID-19 vaccine. I will leave links to it in the description below, so just stay up to date with it. Okay, so let's begin with the first topic. How does the Oxford AstraZeneca COVID-19 vaccine actually work? Well, to help us understand this, we first need to understand how the actual COVID-19 virus works, and then we'll be able to understand it a lot better. So I'm going to try and simplify it to the best of my ability. So to begin with, we have the COVID-19 virus, and it has on the outside what we call spike proteins. Now these spike proteins help it connect, attach to your healthy cells. So once the spike proteins have stuck to your healthy cells, the COVID-19 virus is able to pull itself into those healthy cells and take over. This is otherwise known as an infection. Now the problem is, the COVID-19 virus is very good at not getting caught. It's very good at being able to hide inside those cells, which means it's difficult for your body to find it and kill it and get rid of it. So this means that the virus is able to use the tools within your healthy cell to multiply and replicate. And once it does this, it's then able to go and infect more healthy cells. Now the problem is, it takes a bit of time for your immune system to notice this virus, but once it does, it starts to build defense proteins, which we call antibodies. Now these antibodies are then able to stop these spike proteins that we just spoke about from sticking to more healthy cells. Now on top of that, your antibodies can also send signals to your immune cells called T cells. T cells are able to then come along and gobble up the virus so it's no longer able to attack your healthy cells that we just spoke about. They can also send signals to other immune cells to come over and help us to get rid of this virus. Okay, so you now have a brief understanding of how the COVID-19 virus works, which is great because it's going to be really easy for you to understand how the Oxford AstraZeneca COVID-19 vaccine works. So in short, this vaccine contains a dead virus shell. Think of it as an empty eggshell, for example, without the egg white or the egg yolk in it. This dead virus shell is called an adenovirus. Now there is decades of research on using adenoviruses to help us with vaccines and to deliver whatever we want to put inside them within your healthy cells. Now, for the Oxford AstraZeneca COVID-19 vaccine, what we put inside this adenovirus, so inside that empty eggshell that we just spoke about, is a small bit of genetic code from the COVID-19 virus. That genetic code is the part which uses the healthy cells to make the spike proteins that we just spoke about. So them spike proteins that are needed to attach to your healthy cells. So your healthy cells are able to read the COVID-19 genetic code that we've used in the vaccine to produce those spike proteins that we spoke about earlier. So your body is creating those spike proteins. It says, here you go, look at these spike proteins, immune system, and make me some antibodies and make me some T cells, which we just spoke about, which means that we're not waiting for that lag period. We're not waiting for your body to learn how to fight against COVID-19. We are creating the actual antibodies and the T cell so they're ready. They are ready to fight. They're floating around in your bloodstream. So then if you do get infected with COVID-19, hopefully your symptoms are going to be very minor and you're easily going to fight it off. So I hope that made sense, but I know what you're thinking. You're probably now thinking, well, what happens to that DNA and what happens to that adenovirus? Well, the good news is it takes a couple of days and your body breaks them both down and gets rid of it. So don't be worried about it. Also, the adenovirus, if you remember what I said about it earlier, is it's a dead virus shell, so it can't replicate, it can't really do anything, and it can't cause you any harm. Please remember as well, the DNA, the genetic code bit that we're actually using from the COVID-19 virus is just the bit that we need for the spike proteins. So it's not the entire genetic code to infect you with COVID-19. So you cannot get COVID-19 from the Oxford AstraZeneca COVID-19 vaccine. Okay, so in this part of the video, I want to talk about the research and the clinical trials done on the Oxford AstraZeneca COVID-19 vaccine. This is going to be really factual. I'm going to keep it brief, but please remember, this is real science in action, so it's going to be some great stuff. Also, if you are looking for some specific information in this video, I am aware this is going to be a really long video. I am going to chapter it in the description below. So if you're looking for some specific information, feel free to click on that description and click on wherever you want to go. Now let's begin. So the initial trials involved 24,000 people of different age, gender, ethnicity and race. These were done in the UK, Brazil and South Africa, which is great to see because it's such a broad population that you're using, which is really important in clinical trials. There are also still trials happening within the United States, Japan, Kenya and India, which is great to know that we're still getting updated by scientists across the world on the Oxford AstraZeneca COVID-19 vaccine. Now here's the fun bit. To measure the effectiveness of the Oxford AstraZeneca COVID-19 vaccine, scientists measured how many antibodies were produced against the spike proteins that we spoke about earlier. Now, after the first dose of the COVID-19 vaccine, scientists found a high amount of antibody production, which is great news, but here's the better bit. So even up until the second dose, scientists found that their antibodies were still high, which means that even after the second dose, you're going to have even more antibodies than you had in the first place. Now, what does this mean, a high amount of antibody production? Well, in theory, if you have a high amount of antibody production, in theory, it's going to mean longer protection against the COVID-19 virus. However, this is still being researched, so please watch this space. And finally, 11,000 people within the phase 3 clinical trials of the Oxford AstraZeneca COVID-19 vaccine showed that this vaccine has a 70.4% efficacy against developing COVID-19 symptoms. Now, it is important to note that we still don't know whether the Oxford AstraZeneca COVID-19 vaccine will protect everyone from getting ill or everyone from getting serious illness from COVID-19. We also don't know how long the protection will last, so whether it's going to need a booster dose or you're going to need more doses in the future. And we also don't know whether the COVID-19 virus will mutate or change with time, and if any updates are needed or any changes are needed, which is why scientists are constantly monitoring this and checking it to stay on top. Okay, so now let's move on to how do you get the Oxford AstraZeneca COVID-19 vaccine? How is it administered? Well, it's an injection, it's intramuscular, and it's in the deltoid right over here. When you've had your first dose, you don't need to wait 15 minutes to check for allergies or anything like that. This is different to the Pfizer-BioNTech COVID-19 vaccine. However, if you are going to drive, you should ideally wait 15 minutes before you drive. If you want to go home straight away, it's preferable that you get someone else to pick you up, to drop you off and take you home basically. The second dose of this vaccine is given at least 28 days from the first dose. It's a 2-dose vaccine, similar to the Pfizer one as well, which is a 2-dose one. So now let's talk about who can get the COVID-19 vaccine. If you're based here in the UK, please remember the COVID-19 vaccine is free of charge on the NHS, available to anyone who wants it. Now obviously there is a rollout plan for it and a high priority groups will be going first. This is going to be changing often, so the best thing I'd advise everyone to do is click on the NHS link, which I'm going to leave in the description below, and stay up to date with it. So the NHS is currently offering the Oxford AstraZeneca COVID-19 vaccine to those at most risk of COVID-19. So what I'm going to do is I'm going to leave a little box here somewhere with that list of people who are the first ones, who are the most at risk, who are able to get the vaccine now. But please remember, this list will be growing. It's going to get wider and wider with time. The Joint Committee of Vaccination and Immunization, which we call JVCI for short, these are the people who are really smart and they advise us on who to do first, who are the most at risk, but they will constantly be changing this. Please also remember that the NHS will let you know when it's your turn for your COVID-19 vaccine. They will be in touch with you. Please don't bother contacting your GP surgeries who are already super busy about the COVID vaccine. There is an order, the JVCI have determined that order, and your surgery will be in touch with you. They have not forgotten about you. They will be in touch with you. And on an even more serious note, there have been quite a few scams happening recently with regards regards to the COVID-19 vaccine, people are getting calls out of the blue from unknown numbers, pretending to be the NHS, asking for money and personal details to get the COVID-19 vaccine. Please do remember, this is a scam. The NHS will never charge for the COVID-19 vaccine. This is always going to be free. Please don't give out any of your personal detail and hang up the phone if anyone calls you with this scam. So next up, we have who cannot get the Oxford AstraZeneca COVID-19 vaccine. So currently, if you have a severe allergic reaction or anaphylactic reaction to any of the ingredients in this vaccine, you should not be getting it. Now, if you're wondering about those ingredients, I am going to leave a full list in the description below, so please check it out. Also, if your first dose of the Oxford AstraZeneca COVID-19 vaccine has caused a severe anaphylactic reaction or a severe allergic reaction of any sort, your second dose should not be the same vaccine, and you will have to discuss this with your healthcare professional. Another set of people who should avoid getting this COVID-19 vaccine currently include pregnant women and those who are 18 and under. However, this information may change with time, and I'm going to talk about this in more detail after the next point. And please do remember, if you currently have COVID-19 or if you're recovering from COVID-19, please do not go and get your vaccine until you're fully recovered. If you're unsure about this at all, please contact your healthcare professional and speak to them. But the last thing that we want you to do is to go to these vaccination centers, these hubs, wherever you go, and end up spreading COVID-19 to other people. So if you're unsure at all, please speak to your healthcare professional. Okay, so now let's move on to pregnancy and let's talk some science. You're probably aware that a lot of vaccines can be given safely during pregnancy. So the question is, why are you now being advised not to get the COVID-19 vaccine right now during pregnancy? Well, to be quite honest with you, it's very simple. The COVID-19 vaccine has not yet been tested in pregnancy. This means that until more information and more research is available on this, those who are pregnant should not routinely get the COVID-19 vaccine. Now, please remember though, that evidence from non-clinical studies of the Oxford AstraZeneca COVID-19 vaccine have raised no concerns about its safety in pregnancy. So non-clinical evidence is required before any clinical studies can be done during pregnancy to check its safety. So this is usual protocol, that until you have that information, to avoid the vaccine, avoid COVID-19 vaccine during pregnancy, until we have more information and then clinical studies are done. So please remember these facts, and this is usual protocol. It's nothing different to what we usually do. There's no evidence that the COVID-19 vaccine is unsafe during pregnancy, but basically we just need more information and we need more research on it until we can recommend it routinely for patients. Unfortunately, there's a lot of misinformation on this topic, so I really hope this information helps. Now, in the UK, the JVCI currently recommend two situations where you may be able to get the COVID-19 vaccine during pregnancy. The first one is if your occupation puts you at a higher risk of COVID-19, and the second one is if you have any health complications or conditions that could put you at a higher risk of having complications from getting COVID-19. Now, in terms of breastfeeding, there's currently no data on the safety of the COVID-19 vaccine on breastfeeding or breastfed infants. Despite this, the COVID-19 vaccine is not thought to be a risk to breastfed infants, and the benefits of breastfeeding is very well known. Now, because of this, the JVCI has recommended that the vaccine can be given to those who are breastfeeding. This is in line with the information given in the USA and by the WHO. And once again, please do remember that this video was filmed on the 23rd of the 1st, 2021. All the information I'm giving you today is up to date on this date. However, this information can change with time as we get more research and we find out more information. So the best thing you should always do is speak to your healthcare professional, and also visit the NHS and WHO website. The links I'm going to leave in the description below to stay up to date. Okay, so I hope you're still with me. I hope you're still enjoying the content and find this information helpful. If you are, make sure to whack that like button just to show that you're enjoying the content and you're finding it helpful. Now let's talk about the side effects of the Oxford AstraZeneca COVID-19 vaccine. First of all, the side effects are very similar to other vaccines. The main side effect is a sore arm. I know I had a sore arm. I had a sore arm for about 3 to 4 days afterwards. Same with my friends, same with my colleagues. That was probably the main side effect. The other side effects to be aware of as well, however, is that it can cause a temperature which can last for about 48 hours, a bit of a fever. This is normal. You can also have a bit of a headache. You can feel a bit tired. You might feel a bit nauseous. You can have a few aches and pains in your joints and muscles. These are all normal and they will go away. Now, so far, people aged over 65 have reported the fewest side effects. Also, it's important to remember when you get your first dose, there might be a bit of redness, a bit of swelling for a couple of days, but this should go. But please do let your healthcare professional know when you're going for your second dose how it was, if you experienced any side effects. That's really useful for them to know as well. Please remember as well, when you get your second dose of the Oxford AstraZeneca COVID-19 vaccine, you're less likely to have the side effects again. Now, if you're struggling with any of these minor side effects, such as the fever or the aches and the pains, then you can take over-the-counter analgesia if it's required, such as paracetamol or ibuprofen. But always speak to your healthcare professional first before you take any medication. This is super important, and always read that information leaflet that comes with the medication. These are both super important just to make sure that you're safe and suitable to take the medication, because your safety is the most important thing. Now, another thing that I'd like to mention to you is something called the yellow card reporting scheme. This is something that we've been doing for many years in the UK, and we do it for all medicines, new ones, old ones, whichever. You can fill out a yellow card report for them, talking about any side effects or problems that you had with that medication. So it's even more important for new medicines like the COVID-19 vaccine, for example, that we do these yellow cards, because we're going to gather more data, more evidence, and gather it all and collate it all together. It's going to be really helpful for scientists and healthcare professionals, not only here, but all over the world. So if you can do this online. Anyone can do it. You don't have to be a healthcare professional. If you've had the vaccine and you've had any side effects or problems with it at all, please do fill a yellow card, because it's going to be super helpful for all the scientists around the world. Another point that I'd like to mention is, please remember that if you develop a continuous cough, if you lose your sense of taste or smell at all, or a reduction in it, or if you have a constant fever, a temperature over 37.8 degrees Celsius or 100.4 degrees Fahrenheit, then these could be a sign of COVID-19, these classic symptoms that we're all probably aware of. You may have got it before the vaccine, you may have got it after the vaccine. This is a possibility. So please remember, these rules still apply to everyone. So if you do get these symptoms, please self-isolate, follow your government guidelines. Here in the UK, please visit the NHS website and please arrange yourself a COVID-19 test whilst you're self-isolating. And now on to the final burning question: how long is this vaccine going to be effective for? Unfortunately, we can't see into the future, so we're still not sure about this. Scientists are still researching into this. There may be a case that in the future we might need a booster. So after your second vaccine jab, you might need a booster every 6 months or a year, similar to how we do the flu jab, for example. But this still has to be proven. We're still researching into it and trying to find out more information. We also don't know yet if it stops the spread, if it stops the transmission of the virus. This still hasn't been proven. So the best information I can give for this is, please just stay up to date. Look, the information that I'm giving you today is up to date for today, really, okay? So you need to stay up to date with the WHO, with the NHS, with any organizations that you follow in your country where you're watching this video, and I will leave links to these in the description below. So for my final thoughts, I think that the Oxford AstraZeneca COVID-19 vaccine has proven to be safe so far. The clinical trials that we spoke about earlier showed no safety concerns, which is exactly what you want to hear. And the clinical trials were done on a large number of people. They're still being done as well. And also they were done on a diverse number of people, different ages, different ethnicities, which is everything that you want to see in a clinical trial. But despite all of this, please do remember that if you do get the COVID-19 vaccine, we still need to maintain social distance, we need to wash our hands often, we need to wear the face masks. All of these things still need to remain in place, because we still don't know whether the vaccine stops transmission. That hasn't been proven, and there still is a chance that you can catch COVID-19 even after the vaccine. So it's super important that we still maintain the social distancing and all the things that we've been doing currently. So as I did mention earlier, even if you've had the vaccine, if you still get these kinds of symptoms of COVID-19, such as the constant cough, the loss of taste or smell, the high fever, any of these sort of symptoms which we know of COVID-19, the rules still apply. You need to self-isolate, you need to follow your government guidelines. If you're here in the UK, you need to self-isolate. Go on the NHS website and get yourself a COVID-19 test as well. I will leave links to it in the description below. And just to remind you one last time, This video was filmed on the 23rd of January 2021. All the information I've given today is up to date today, but this information can change with time. So please stay up to date with information online from the WHO, the NHS, and also your local government websites that you know and trust. I will leave links to these in the description below. If you've made it this far in this video, I want to thank you for watching the video. I hope you found this information helpful. If you would like a video on the Moderna COVID-19 vaccine as well, please leave a comment below. If I do get enough comments, I will try my best to make a video on this topic too. That's the end of this week's video. Always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.